Hey everybody, this is Joe McLean. I'm in the Missouri Capitol News Bureau here in Jefferson City. I'm working on a story today about a report that was recently put out from the Center for Healthcare Quality and Payment Reform. What that group looked at is the state of America's rural hospitals, what their financial state is, and it actually found that based on some metrics that it set, that many of them, hundreds in fact, across the country are at immediate risk of closing. They're set to be forced into closure within the next couple of years. There are 8 such hospitals, rural hospitals in Missouri, and there are 29 in Kansas. That's actually the most of any state. So Kansas is, the rural hospitals in Kansas are in pretty bad shape. So what is this looking at? Well, it's essentially looking at the revenue that comes into these hospitals and how that revenue isn't meeting the costs associated with providing the care. Think about a rural hospital. They're in much less populated areas, of course, and so that means less patients are going to be, fewer patients, that is, are going to be going in there and getting procedures. That's not necessarily a good or bad thing. It just means that the scale is smaller. So there's essentially, if you remember micro or macroeconomics, you'll remember economies of scale. If they're not having to offer such a unique, complicated service as much, the individual times that service is offered is more expensive. And rural hospitals just are more expensive. They're more remote. Like I said, fewer people go to them, so it generates less revenue. And then also they get reimbursed at different rates from private healthcare and Medicare and Medicaid. Typically, private healthcare companies, these small rural hospitals are not as they're not as in good of a bargaining position when they're negotiating the reimbursement contracts with these companies. So they're often left with reimbursement rates that don't cover the cost associated with providing the care. So and then also those costs have been going up. They've constantly been going up. So it's just kind of a revolving cycle of peril for these rural hospitals. Anyway, what I've spoken to the Missouri Rural Health Association Executive Director and the founder and CEO of the Center for Healthcare Quality and Payment Reform to talk about the results, what this study found, and what the solutions are. That's a really important thing. How can we fix this issue? Because just because you live in an area of the country that might not be close to an urban center, or you might be out in a remote area. A lot of people are. Do those people just not get health care? No, it's important that they still have emergency services, that they still have access to robust health care. One other challenge I didn't mention, though, is the cost of labor has been rising as well. And it's difficult to recruit people out in those areas as well. Anyway, lots to talk about. Let me know if you have any questions. Leave them in a comment in this video, and we'll check in soon.